Welcome to the Robertson and Easterling podcast. Thanks for listening. I'm Matt Easterling.
And I'm Craig Robertson. Matt and I are Mississippi divorce attorneys who work with real people with real life struggles. Helping them identify and achieve their goals is not only our job, it's our passion.
Even the thought of divorce is deeply personal and emotional for both sides, and you cannot ignore those feelings if you want to be healthy.
In our podcast, you'll hear stories from people who are further along in their journey. You will also learn from our network of professionals who would teach you about wellness despite your circumstances.
So sit back, relax, and take a deep breath. Everything is going to be okay. What you're about to hear is going to help. We're back for part 2 of our 2-part podcast with Dr. Mark Hagwood. If you didn't listen to part 1 yet, stop, go back. I think you'll really enjoy it. We've already talked about Mark's childhood and his experience with addiction, both personally and professionally, his blended family and story of surviving divorce. In today's episode, we want to talk more about Mark's professional work with Turning Point Counseling and his experience with different personality disorders and issues that a lot of people that our listeners would probably be interested in hearing about today. Mark, thanks for coming back.
It's good to be here.
So let's just jump right in, Mark. There's buzzwords in my practice, and we hear words like narcissism, borderline, bipolar. And in my experience, it's one of those things that you know it when you experience it. Give us a definition, if you will, of narcissistic personality disorder. Describe that for our listener.
Narcissistic personality disorder, like the real disorder, is a long-standing approach to life that people that suffer from that, they typically tend to be very self-absorbed. They think mostly of themselves without really thinking or understanding how their behavior impacts others. And one of the chief characteristics that I look for is a lack of empathy. They just don't connect emotionally with other people. They don't understand emotions very well.
Narcissistic personality disorder, is that something that develops in a person over time, or is it nature or is it nurture?
Yes. So when you're talking about nature and nurture, you're talking about whether it's genetically based or do we pick it up somehow in the environment. Depending upon what research you're looking at, there appears to be evidence of some genetic components to a lot of our behavior, not just narcissistic personality disorder or other things. It's interesting, the field of genetics is indicating that we can actually turn genes on and off through behavior, through environmental factors. And so let's just open that can of worms. Let's say that, yes, there are genetic correlates to narcissism or borderline personality disorder or whatever. We still have to have environmental things, trauma, abuse, neglect, sexual abuse. Like in narcissism, there's a couple schools of thoughts on it. One is that it's created by overindulgent parents giving a whole lot of praise and building up a child past what is reasonable in life. And then there's the other part of that people with narcissistic personality disorder have had a lot of early childhood abuse and trauma and neglect. I think it's both because they've identified clinically, not from a diagnostic standpoint, 2 basic types of narcissistic personality. You've got the overt, which is kind of the typical expression that you would think of, angry, very controlling, play a lot of mind games with their spouse. And then there's this vulnerable or covert narcissist that is hypersensitive to criticism, and they fall into periods of pity, not self-reflection, but self-pity. Then that spurs their anger, and they lash out from there.
I'd be interested to know. I've no idea what the science says. I know that in my practice, it seems like over the last, I would say 2 years, almost every one of my clients believes that they're married to a narcissist. What does the science say about how prevalent narcissism is in our society? Is it 1 in 10? Is it 1 in 20? Is it what percentage of our population are actually narcissists?
Thankfully, it's not a huge number. Prevalence rates depend upon the study that you're looking at. So, I would just say from sort of a combination of all the reading that I've done that maybe 5%, some are like 0.5, others are 8%. I don't believe that it's that high. But that's true narcissistic personality disorder,
right,
not narcissistic characteristics.
So if I'm hearing you right, a large number of my clients, some of them may be married to narcissists, but a lot of them are just married to jerks.
Yes. However, I think that you guys and people that come to my office, there's a higher prevalence rate that we see because we're dealing with people that are in crisis, right?
Sure.
And so we get a higher level of people that show up with a spouse that may have a mental disorder or an emotional disorder because they're hard to live with.
Right. And a disorder is not the same thing as having those characteristics. For example, one of the diagnostic criteria for NPD is a grandiose sense of self-importance. Well, that describes a lot of people and, preoccupied by fantasies of unlimited success. Some might say our president falls into that category. So there's lots of, people have tendencies. And then there is the full-blown disorder, which is not necessarily the same thing.
That's correct.
So let's talk a little bit about borderline personality disorder, or BPD. And how is that different than narcissism? Because in my experience, it just feels like they're almost like first cousins.
Craig, there's so much when you start talking about personality disorders that your average listener is going to be 100% bored with. So I'm trying to skip some of that, but there's a lot about NPD, narcissistic personality disorder, and BPD, borderline personality disorder, that are similar, and it's not uncommon to find somebody with NPD that marries somebody with BPD, and that's a much bigger conversation. But narcissistic personality disorder is different from borderline personality disorder in a couple key ways. One is that NPD, they have no empathy. Borderline personality disorder, those people don't have a very strong sense of self-identity, right? And so when I'm looking at somebody in my office and they don't have empathy, I'm thinking one thing. When somebody comes into my office and they have a very chaotic life, that they talk about how they get easily upset with people in their life, and they get very angry, or they feel like they're being abandoned, and they're very hurt, and it's super chaotic. I'm thinking borderline personality disorder.
When I think borderline, I think, I hate you, don't leave me.
Right. Come here, go away. That's typical kind of borderline behavior. And what that looks like is, let's say that you're dating somebody, right? And they send you a text message and you're super busy and you can't get back to them for a couple hours. And when you call them, they're raging at you because you're ignoring their text message, that you clearly don't care, and that just is this tirade that for most people, you're like, wait a minute, that doesn't match what's going on. Those are kind of the way that sometimes a borderline personality disorder is expressed. It is a real or perceived abandonment that spins these people up.
And these things are hard to diagnose. It really takes a therapist sitting with someone for an extended period of time before there would be a diagnosis. And my understanding is that most people who have those types of characteristics don't typically walk into a counselor's office anyway.
Well, first of all, these are complex disorders, and they do take somebody that's trained over a period of time of sitting with somebody in order to be able to determine if that's really what's going on. Stress, crisis, unresolved trauma can create behavior that looks like any kind of disorder. So it takes a while to diagnose.
We work with people in the most intimate parts of their life and the most intimate communications. And you described the situation with the text message just a couple of seconds ago. And, that's something that would be really, really, over a long period of time, would just be something that would wear a person out. And because we are a fault-based divorce system in Mississippi, those types of nuances that can make a marital relationship just impossible to continue in, are oftentimes in a courtroom type setting, really difficult to explain. It's like, well, I mean, okay, she got mad because you didn't text her back. What's the big deal? But that's one thing. But when that happens 5 times a day, every day, and it just creates this immeasurable weight, I think that is where our clients have difficulty, because they know what they're experiencing, but not everybody is a trained speaker like you and me and can articulate how that actually impacts them. You're smiling because I know you want to say something that you're trying to not say.
So much there. I heard somebody describe being married to a borderline like their soul was being sucked through a keyhole.
Ooh.
You know, it is you never know what's coming. Like there's a book about these, it's called Walking on Eggshells, right? And so you don't ever know if you're going to walk in and your spouse is going to be all about you, or you're going to walk in the house and they're going to just lash out at you. And it does take a toll. I mean, it's complex trauma is what it is. When we're married to somebody that we don't know emotionally where they're going to be, there's this sense of dread and anxiety throughout the day. There's this sense of, okay, how am I going to manage this next interaction with this person? So instead of having a home life that's secure, attached, and safe, there's this underlying anxiety and fear that no matter what I say, it's not going to be right. That I don't know how to express what's going on, because if I say one thing today and I say the exact same thing tomorrow, I can't ever tell what's going to land properly.
And that's breeding ground for codependency.
Yes.
And the way that I see codependency, my best understanding of codependency is if I look over at my spouse in the morning and say, honey, how am I feeling today? Am I feeling good? Are we good? Am I feeling well? Yeah. Okay, great. Let's go throughout the day now.
You know, you talked about the effect that people with these personality traits have on their spouses. Their ability to communicate is being undermined through that entire relationship. So it makes it even harder for them when they get into the divorce process to have any type of conviction or confidence in what it is that they're trying to say. You know, I'm sitting there asking them a question, well, how does this make you feel, and all this stuff? Well, their feelings have been undermined for so long, they don't have a real confidence in the way that they can express it. So it makes it even harder for them to communicate those effects.
A lot of times in my office, I see spouses of people that are married to, you know, somebody with narcissistic personality disorder or borderline personality disorder. They're the ones that think they're crazy, right? And that's their term, not mine. You know, they'll come in like, I'm losing my mind, you know, and they'll get the spouse in there and they'll confirm it. Yeah, you really got to help her out. She's like, something wrong with her. Like she doesn't get out of the bed anymore. She's super on edge all the time. But you know, Doc, you really got to fix her.
We hear the term gaslighting, and it sounds like that's what you're describing.
Absolutely. You know, gaslighting is a term that you find in addictions a lot of times, because when an active addict is on their roll, they're trying to make everybody else think that they're okay. And the only way to do that a lot of times is to make the other person feel like they're crazy. People with personality disorders do the same thing because they really believe that it's everybody else.
So I'm curious to know, a lot of my clients, when they believe that they're married to a narcissist or somebody that has borderline, they want us to push through the divorce process for a psychological evaluation. How easy is it for somebody that maybe is a narcissist or has borderline personality disorder to mask those things through a psychological evaluation? If they're smart enough, do they know the things that, oh, I shouldn't answer this question this way or that way, as opposed to, you know, extended treatment where you're getting to spend a lot of time with these individuals?
So I would say it depends on the psychological evaluation that they do. There are some instruments out there like the MMPI-2 that you can't fake that one. However, I don't know what it would take to make somebody take the MMPI-2 that was unwilling to do it. That's more of a legal question. But, you know, some of those instruments that are reliable and valid and they've given that instrument to hundreds of thousands of people, either if they try to fake it, it's going to clearly show that they're deceptive. But if they are honest, it will pick up on those traits and even the disorder.
This sounds like nerdy lawyer stuff, and maybe it is nerdy lawyer stuff, but when you're working with mental health professionals, sometimes you have to differentiate the role. Is that person a therapy provider, or is that person an evaluator? And in my experience, a therapy provider is going to be very resistant to label their client. And I understand that, because the idea is to build rapport and to build relationship and to build trust and to work through that. And then when you start labeling people, then it undermines that process.
That's true. With my clients, I move away from diagnostic labels, because really a diagnostic label is just simply shorthand for communicating a cluster of behaviors found within an individual. And so I don't typically say, hey, man, you've got narcissistic personality disorder, right? I want to get to the causes and conditions and maybe try to help this person function better in life. Psychological evaluators, like a clinical psychologist or others in that area, will administer tests and be able to give them the written results.
I hope you're enjoying our show. My name is Cassie. My job is to take care of the Robertson and Easterling clients. I love helping people. Listen, the lawyers in our office are some of the smartest people I know. I know that you're scared and emotional, and that's totally okay. But when the plane's going down, it's important to put your oxygen mask on first before you can care for those around you. Request a consultation from our website or just give me a call. Everything's going to be okay. I can't wait to meet you, but until then, sit back, relax, and enjoy the second half of today's show.
Let's introduce one more little buzzword into the equation of our discussion today, and that is bipolar. If I've heard it once, I've heard it 100 times. I mean, she's just bipolar, or he's just bipolar. And it seems like that's kind of a catch-all term. But for me, bipolar is that roller coaster ride, just mania, meaning high energy, high activity, down to the lower part of the roller coaster, which is I can't get out of bed, I'm depressed, I can't feel, I'm drinking too much. And so when I think of bipolar, I think of a roller coaster. When I think of narcissism, I think, like you said, that lack of empathy. And when I think of borderline, I think, I hate you, don't leave me.
One of the things with borderline that I would throw out there is chaos. So it's a very chaotic individual inside emotionally. Bipolar disorder has some very specific criteria that are super unimportant to lay out there. Other than to talk about your typical expression of bipolar, there will be a mania phase to it, right? And so I look at these things as a continuum. Like on the far outlier of bipolar disorder, those are pretty obvious. I mean, you can have hallucinations. You can think that you're talking to angels. You can think that God has given you certain powers. And I mean, like when you're in that mania phase, that person's in that mania phase, like they really, really believe it. And then when they sink into their depressive thing, they don't necessarily 100% believe it, but there's always that thought in the back of their head of maybe I am kind of special. Maybe I really was talking to angels, right? And so that's on your far end of your continuum. Now, if you back out of that, not all bipolar is that high level sort of psychotic features. You can have people that go into the mania phase and they have more energy, right? And so they clean the heck out of the house and they act out sexually, or they spend a whole bunch of money buying timeshares in Guatemala, right? And then they come out of that and they're like, what the heck was I doing?
Well, Mark, are you saying there's something wrong with timeshares in Guatemala? Or?
Oh, man, if that's your thing, knock it out. But if you buy 14 in a week, I would say yeah.
Okay, that's fair.
So it's a different expression, right? And so I think people sometimes confuse bipolar with borderline personality disorder because some of the behaviors are similar. Borderline personality disorder is sort of an ongoing chaotic. There's not a whole lot of pattern to it. Like this person was really up for a week and they had 3 or 4 sexual partners and they spent a bunch of money. That's the bipolar swing. Borderline is that their world is defined by external relationships with people. And so they will have chaotic interpersonal relationships that aren't romantically based. I mean, all their relationships have chaos involved with it. They'll act out sexually in order to feel better about themselves. They may spend money or shop because they're trying to gather organization for who they are. Bipolar, it's a result of that mood instability, that euphoria phase followed by the down cycle.
And so with bipolar, you can, if you know that your partner or somebody in your life has bipolar, you can see that they are moving through this sort of manic arc and then predict that there's about to be this dip. Whereas if I'm hearing you right, with borderline, it's just all over the place. It's erratic. There's no way to predict what's going to happen next.
And it sounds like borderline is more relational as well, I think you explained.
Yeah, borderline personality is externally triggered, right? Something in the environment triggers the reaction. Now, it's not always as clear what that event is, right? Now, with bipolar, the mania triggers the behavior, or the depression triggers the lack of behavior, the getting into bed and I feel like I want to kill myself and life is awful.
So it's internal triggers.
Yes.
And we're not going to try to teach a course in abnormal psychology today, but sure, let's complicate a little bit more, because when you start adding in alcohol and drugs, then we get real fun, right?
Oh yeah, it's a great time.
Because I think that's what a lot of our clients experience is, yeah, Craig, all that y'all just said, but he drinks a lot too, or all that you just said, but she's taken more Adderall than, a human being should possibly be able to process. And when you add those things, you have a recipe for, gosh, not just chaos, misery.
Yeah, I mean, it's hellish, really. One of the confusing factors, and it takes a trained clinician to dig through some of this, is, let's say that I've got an active chemical addiction. Well, if I'm doing cocaine one day, like 3-day run on cocaine or meth or Adderall, and then I switch over to benzos, Xanax, and alcohol, I mean, my behavior is going to mimic bipolar, because I'm up and running for 3 days straight, and then I crash and burn for a week.
I represented a guy many, many years ago, and he was a great guy. He had a great heart, but he suffered a traumatic accident, and he had a lot of pain, and there were financial pressures, and so he had to work, even though he was really disabled. And to be able to work, he'd take many thins. He'd take literally a handful of many thins, and he would work through the pain, and he would do his job. And then, after he had worked his, 12-hour shift as a disabled person, he'd drink beer, and he would drink the beer to come down from the many thins. And when you process that type of chemical in your body over an extended period of time, things start falling apart in your world.
Yeah. I mean, there's a physical consequence to drug and alcohol addiction for sure.
Mark, our listeners are listening to this and they're thinking, oh my gosh, I'm married to a narcissist. Oh goodness, I need to Google about borderline. Let's talk about some hope. I mean, obviously there's divorce, but when you have children with somebody, you're going to be divorced from somebody who's NPD or with bipolar or borderline. So what are we to do, Mark? We've talked about these very complex issues that affect real people, everyday people, because I talk to them every day and I know you talk to them every day. So what's a person to do?
Well, fortunately today we understand these disorders better than we ever have, right? So there are treatments. There's an real effective treatment for borderline personality disorder that for years most people thought, some of these diagnoses were hopeless. And, dialectical behavior therapy has shown absolute wonderful results with people suffering from borderline personality disorder. That I would say get involved in a therapeutic process with a therapist that understands the complex dynamics of these personality disorders, or even, bipolar. You have the person that's suffering from the disorder, and then you have the people in the family with that person that are also suffering. So a lot of times what I find is helping the spouse and maybe the children get an understanding for the dynamics that are going on can increase some empowerment.
And with bipolar, there are certain medications that have had success in helping people live normal, healthy lives. Isn't that true?
No, absolutely. Bipolar, if you find the right medical combination to it, that disorder becomes very well controlled. We can give, or psychiatrists or physicians can give medication that treats some of the anxiety and depression around borderline personality disorder, but doesn't get to the internal core problems. So, there are a lot of different treatment options.
It's good to hear you say that, some of these personality disorders can be improved or helped through treatment. But I know one thing that I hear from my clients a lot is they say, well, if I can just get, my husband into counseling, or if I can just get my wife to go see this therapist, is it not true? It takes the person that's actually being treated being willing to go and willing to participate, because it's not going to do them any good if they're sitting there and saying, there's nothing wrong with me. There's nothing that I need to fix. I don't need to work on me. Correct?
It takes an absolute dedication from the person with, let's say, narcissistic personality disorder to even begin to get better. And what I mean by that is that particular disorder, if we're talking about real diagnosable disorder, their thinking is so distorted that it doesn't really change very well over time without them beginning to understand that it really is something about them.
And for our potential listener, I think what I heard you say is really awareness. And the listener is hearing these terms or something that's resonated with them about, the dynamic in their family, the dynamic in their relationship. But it really starts with awareness, understanding the situation that you're in, understanding yourself, and then you can make an informed decision about whether or not the relationship is even something that you can continue in. Because, I'm not afraid to say it, because a lot of people would say, look, if there's true NPD or there's even strong narcissistic tendencies, the only option is to move away very quickly.
Yeah, there's some truth in that.
And, sometimes it takes a lot of bravery, especially here in the Deep South, in our deep Christian faith that many do have. And the idea that, my marital commitment is a lifelong commitment, and the ability to recognize when things simply aren't going to be better, and that each individual does have the right to have a full and complete life.
Yeah.
Well, for anybody out there that maybe suspects that they are in a relationship with somebody who has one of these personality disorders and they're not quite ready to walk away from the relationship, do you have any advice? What would be the best way for them to approach their partner about being open to going to counseling or going to some type of treatment?
They should trick them, right?
Yes. A lot of times people will come into therapy because one of the spouses has sort of gotten to the point where there's an ultimatum laid out. Like, we're going to go to therapy or else we're going to get a divorce. And so I have had many clients show up, we'll just use the wife-husband dynamic, where the husband has a narcissistic personality disorder, okay? So the wife comes in initially because she's losing her mind, right? She's being abused either physically, but for sure emotionally and psychologically. Well, the husband will come in sometimes just to make sure that I'm getting the complete story. And so that's common. And if you can get those guys hooked in, you may be able to make some traction. And what I mean, my first goal is to create some safety within the relationship for the spouse, because that spouse is being abused, right? Not the kind of abuse that's going to really be easy to prove in court, but the psychological and emotional impacts of that are tremendous. I've had clients that suffer from unresolved traumas that gets expressed physically. And they begin to develop lower back pains, a whole lot of anxiety-related things, or the immune system starts getting jacked up. So, it's living in this chaos is very difficult for the spouse.
Right. And I think one of the this sounds almost schoolyard type bullying, but one of the meanest things that an abuser can say is you're just stupid. You're not valuable. Your thought process isn't valid. And as Matt said earlier, as we were talking through this, they start to believe it, and they, well, I'm just dumb, or they get into that cycle of negative self-talk. And sometimes it takes, a third party giving them feedback and validating them and saying, no, you're not stupid. Anybody would have responded that way to that type of circumstance. And I think that's unfortunately, I can almost see it in their face when they come in. There's that the shoulders are shrugged, and that just sad affect. And, it's when someone's been beaten down by that. And, and I think there's hope for people, because there are, your life is not hopeless. Your life is worthwhile. And there are lots of people who can help you. And it's not always the lawyers that can help you, but, if there's someone out there listening right now that feels like this is their life, this is their role, then I just would ask that they consider deeply reaching out to another person, even if it's starting with a friend, to get this stuff into the light. We've talked in the past about, someone living in a basement that's filled with broken bottles and garbage and bones and mold and mildew, but all they see is their little flashlight. And, as long as that little bitty light is okay and they can point it in the direction they need to go. But when you flip the lights on, you look around like, oh my God, I can't believe I'm here.
Well, for the most part, I usually characterize divorce as being a sort of a destructive process, and it's certainly not a fun one. But every now and then, when you are dealing with somebody that maybe who has been married to somebody with one of these personality disorders, divorce can become a very empowering event, where they learn that they do have self-worth, and that I can live without him, or I can live without her, and I can do this, and I'm smart, and I bring things to the table. And that really is, a beautiful thing to watch somebody grow from feeling weak and insignificant, powerless, to, being completely independent and doing things on their own and being able to stand up to that bully. I tell people all the time that, one of my favorite things is to bully bullies. And it's great watching somebody who has been trampled on for a long time finally stand up to the person that's been beating them down.
And not only that, which is hugely freeing once they figure out they have a voice, but I watch women who are married to some of these guys. They have to come first to the realization that they're not crazy. Or I've heard this over and over. If I could just get him to understand this, that one thing is suddenly going to change the dynamic of the relationship. And when you're working with a narcissist, I've had great sessions with narcissistic clients where they seem to have insight. It's like a light bulb moment, that epiphany that in what I do is so important. And then 2 days later, when I see the spouse, like, you need to talk to him every day. Like, he was great for 24 hours, but then it started to change. And by 48 hours, I was crazy. You as a therapist were nuts. And this whole process is a bunch of BS.
Right. We didn't even talk about the drama triangle. And whoever's listening to this can, I guess, Google drama triangle. But it seems like these conditions that we've been discussing, that they're perpetually in that place. They're either the victim or the rescuer or the persecutor. And when you're in relationship with a person with NPD, BPD, or oftentimes, the manic component of bipolar, then you feel like there is a never-ending drama triangle in which you are engulfed.
And that's because there is.
Let's, in closing thoughts, Mark, let's give hope to some of the listeners. If you could speak to those out there who may have landed in your office or may have considered coming to see you, or if it's too far gone and they think that maybe it's time to have a consultation with an attorney, what encouragement would you give to the spouse of a person who is suffering one of these conditions?
Well, I've seen some very miraculous things happen in my office that I attribute much more to the hard work of the individual showing up than anything that I do. And so if you're dedicated to getting better, like your life is no longer livable where you are, that is one of the best motivating powers that I've ever seen. And so just because you're desperate today doesn't mean that that desperation is going to consume you. It can actually drive you. And in that being driven, we can become free. We can grow from our own personal hurts that are unresolved. We can get to a point of freedom, whether the relationship heals or not. There is a tomorrow that doesn't have this chaos in it.
And I think that that's the most important thing that I've realized in this work is what we all really truly want is freedom. I mean, we want freedom. And when we are imprisoned by the negative life circumstances that are inevitable when these conditions really exist, it feels hopeless. But there really is freedom.
There is, and even if you are in a relationship that you don't feel like you can ever get away from that abusive person because, there's fear of what they may do. I have worked with many people that were in that situation. I know you guys have too, that once that separation occurs, that you really can be free. You're not trapped by the fear of what that person may do. There is freedom out there and peace and happiness.
Mark, thank you so much for being here today and for educating me. I know that I've learned a lot through these last two podcasts. Tell our listeners where they can find you if they suspect they may be in a relationship with a person with one of these disorders, or if they're listening to it and saying, maybe I have one of these disorders. Where can they find you?
So the easiest way to get in touch with me is to go to my website, which is www.turningpointms.com, and there's contact information there.
Well, Mark, thanks for being here, man. Thanks for your openness, your vulnerability, for your knowledge, for the work that you've done both personally and professionally, and we're really grateful.
Well, I appreciate being here. I hope that what we did can help some people.
I'm certain it will. Thanks.
You've been listening to the Robertson and Easterling podcast. Thanks for spending time with us.
We'd love to hear from you if you need our help. You can request a consultation from our website in less than 5 minutes. If you liked our show, please subscribe to our podcast so you'll be one of the first to know when our next episode drops.
Have a great rest of your day, and remember, there's nothing wrong with arming yourself with information. On behalf of Matt and our entire team, thanks for listening.
This podcast is not a substitute for an attorney. All information is provided as a general reference and public service. Listening to this podcast does not create a professional relationship with Robertson and Easterling or any of its attorneys or guests. This podcast may be considered advertising under applicable rules, and free background information is available upon request. For a full disclaimer, please visit our website, www.robertson.ms.